Hello, my name is Doctor Veda, and it's very nice to meet you. Welcome to our clinic. I am going to be performing your medical exam and testing today. So, to start, I just have a couple questions for you, okay? Alright. Can you confirm your full name for me? Thank you. And date of birth? And roughly, when was your last physical? Okay. And any abnormal results or issues? Okay. Date of your last cranial nerve exam? Okay. And the date of your last hearing test? Alright. That was a while ago. Are you having another one soon? Okay, yeah. Awesome. And the date of your last eye test? Oh, okay. So you're due for an eye test. Perfect. And have you been to see a dermatologist? Not yet, but you're waiting to get an appointment. Okay. So we have physical, cranial nerve exam, hearing test, eye test coming up, hopefully dermatologist soon. Any other medical appointments? Okay. Thank you. And are you taking any medications currently? Okay. Dosage? Gotcha. Anything else? Okay. And do you take a multivitamin? Okay. Lovely. Okay, so we can begin the tests. And basically, I'm going to be going through several tests, mostly involving your face, some of your senses, such as your hearing and your vision, taking a look at your scalp. Very basic, nothing at all is painful. If anything is uncomfortable for you at any point, just let me know, but it really shouldn't be. So I'll start with just examining your face a little bit, taking a look at your skin. I have a magnifying light I'm going to use, and I'll be taking some swabs of different areas of your face in order to do some cultures and tests, okay? Alright, so just put that down. Let me get started by just putting on some gloves. Keep this nice and sanitary while I'm touching your face. And again, nothing at all to worry about. This is pretty quick. It usually takes at most about a half an hour, so I'll get you all fixed up and get you out of here. And pretty much I can see today what's going on, but for the cultures it takes about a week to get those back, so that's the only thing you'll have to wait on. So let me just start by well, I'm just gonna come in and look at your face first before I grab the light, and I'm just gonna touch a little bit, okay? So let's just see. Okay. Your skin looks pretty good. A little dryness. Any discomfort? Okay. Does your skin burn easily when you're in the sun? Okay. Get my light. Okay, so this is just a magnifying light I'm going to look at your skin with. Alright. What's your skincare routine? What do you wash your face with? Okay. And do you use a moisturizer? Do you do that once or twice a day, or how often? Yeah. Any special treatments like masks or exfoliating treatments or anything? including those done by a professional. Okay. And any serums or anything that you use? Okay. Yeah, your skin looks really good. I think I'll just end up taking some swabs from your forehead, sides of your face, cheeks, and chin. So, that should be very simple. Just to make sure I get a good variety. Okay. Okay, so I'm just going to be taking some swabs of your forehead first, okay? So I'll be using this cotton swab, and you just light pressure, no real scraping or anything, okay? There we go. And when I have this done, I will put it in a vial, and the lab will do the rest. Okay. Very good. Alright. And it just goes right in the vial. Cap it, and it goes to the lab. And we will do the same to your temple area on the right side. Very good. Okay. And temple area on the left side. Okay. Have you ever had this done before? No. We'll probably end up taking a few swabs from your scalp as well. But that's pretty much it. Just the cheeks and chin and scalp to go, and all the other stuff for the test. Right cheek. Very good. Okay. Left cheek. After this, I'll take a couple measurements of your face, just for our notes, and then we'll move on to your scalp. And just the chin, the last one. Overall, you have very nice skin. Did you have acne at all when you were younger? So that's all the swabs. Now I'm going to be using this little tape measure and just measuring a little bit of your face, okay? So just come in here. Alright, I'm going to do your lips. Good. And width of your eyebrows. Okay. Height of your forehead. Good. Side of your face. of your nose, height of your lips. I'm going to do each eye. Good. Jaw. Height of your face. And right side. Left side. Very good. Okay. So, one more thing with your face. I'm going to be using just the end of one of the swabs and use this end and just gently poking different parts of your face. Just tell me what you feel, okay? Or if you can feel it, alright? Good. Poke. Poke. Okay. Good. Okay. Okay. Alright. Okay. Okay. Good. Good. Okay, excellent. Okay, so your face looks great. Sensation was good. Skin looked good. So we'll just wait for those cultures and make sure that nothing comes back abnormal. But so far, everything looked good. Okay. Now I'm going to take a look at your hair and scalp. Alright, so I'm just going to come in and get in here. You have very nice hair. Okay. Just checking your scalp for any dry skin or buildup. What kind of shampoo and conditioner do you use? Yep. And how often do you wash your hair? Okay. Do you use any treatments, like leave-in treatments or oils or anything? And how about any hair products for styling? Alright, so I'm gonna quickly come around back and just take a look at the back of your head, okay? Alright. Okay. Okay. Just taking a look at the back of your head. Looks healthy. Hair and scalp look healthy, just like up front. Very good. Alright, so now I'm going to take a couple swabs. Just like I said, I'll do 2. A little quicker than the face, so grab these. Okay. And we'll do your up here first on the right side. Get a good spot here. There we go. Okay, just a little bit of your scalp. Alright. the other side. Okay. Lovely. Okay. So that's all the swabs we have to do. And hair looks really good. I do have to take a little hair sample. I'm just going to be taking a couple hairs to try to get the root of them. That way we can examine the follicle and the root of your hair. Okay? So, these little tweezers, I'm just going to pluck right from the root to make sure that we get a root piece. Okay, here we go. I got two right away, and they both have the root on them, so that's perfect. Alright, so that should be great. Now I'm going to be taking a look at your eyes a little bit, okay? Alright. So, I'm going to start by just looking into your eyes with this light. It's a little bit bright. If you could just go ahead and focus right on my nose, and I'm going to shine the light into your eyes, okay? Just look right at my nose. Good. Looking at my nose. Okay. Good. Okay, keep looking right at my nose. Alright. Keep looking right at my nose. Alright, yep, eyes look good. So I was checking for dilation and consensual response, meaning if I shine it into your left eye, your right eye should also constrict, and vice versa. So that looks good. Now I'm going to ask you to follow the light, and I'm going to cover one eye. So start by covering your left eye, and I'll ask you to follow the light with your right eye. Do not move your head. And if the light at any point leaves your field of vision, that's totally okay. Just pick it up when it comes back in. So just following the light with your right eye. Okay. Looking very good. And same thing, left eye. Okay, so in this I'm just checking for smooth tracking, making sure both eyes are able to do this. No issues focusing or following the light. Looks really good. Okay. Alright, now follow the light in and out, and in and out. And now I'm going to have you follow the light with both eyes, okay? So same thing, not moving your head, just following the light with both eyes. If it leaves your field of vision at any point, just pick it up when it comes back in. Okay. Doing a very good job. Alright. So now I am going to grab a second light. And this one has a different color temperature, so this light is warmer. This light is cooler. I'd like you to follow the warmer light, please. Follow the warmer light and ignore the cooler light. Good. Okay. Now follow the cooler light and ignore the warmer light. Good. Okay. Now, which light is warmer? Which light is warmer? Which light is warmer? And which light is warmer? Good. Okay. Now I'm going to be covering one eye again, and I'm going to move this light across your eye. I want you to tell me when it's its brightest, okay? And cover your left eye. Tell me when this light is at its brightest. Okay, so you can look right at it. Good. Coming back. Yep. Okay. Good. Okay. So we're just looking for when it shines pretty much directly in your eye. Okay. Good. Alright. Other eye. Same thing. Tell me when it's its brightest. Good. Good. Okay. Okay. And again. Alright. Now I'm going to be doing the same thing, but with both eyes. Okay. Good. Good. Alright. Excellent. And last eye test, I'm going to be bringing my fingers into your peripheral vision. So just tell me when you can see them, okay? So you're looking right at my face, and my fingers are going to come in. Let me know when you can see them. Okay. Again. Good. And again. Very good. One more time. Very good. Okay. So that is it for the eyes. Now moving on to your ears. So I'm going to go ahead and take a look in your ears using this otoscope. So I'm going to start with your left ear. And I'm just going to look in for any wax that might impact your hearing for the test. Okay. Okay. That looks really good. I don't see any wax buildup or anything. It's pretty clear. Certainly nothing that should impact the test. Okay. And I'm going to take a look in your right ear as well. Okay. Same thing over here. No wax buildup, nothing that should impact these tests. So, looks really good. I'm also going to be doing a culture, so we'll make sure everything is healthy. Okay, very good. Alright, so now that I've done that, I'm going to go ahead and do a quick swab in each ear for a culture. Okay, I'm going to do your left ear. to a couple of files. And now I'm going to be doing a hearing test on you, just a little one. I'm going to come in and say a sequence of words, and I want you to repeat them back to me, okay? So we'll start with your left ear. Breakfast, lunch, armoire. Okay. Deli, cheese, grocery. Okay. Apple, Sunday, orange. Good. Recess, gym class, English. Good. College, university, hair. Excellent. One more. Purple, light, bluegrass. Okay. Wonderful job. Now I'm going to be saying a sequence of numbers. Same thing. Repeat them back to me. 32, 15, 7, 19, 18, 46. Good. 36, 17, 14. Okay. 102, 92, 84. Okay, very good. Now, same thing, but I want you to repeat them backwards. So if I say 6, 19, 4, you will say 4, 19, 6. So you're repeating the sequence back to me in the opposite order. 18, 7, 32. Okay. 19, 13, 14. Good. 90, 40, 18. Good. 100, 16, 2. Very good. So that's a little cognitive exercise as well as hearing, and you did a great job. Okay. So, sequences of words and numbers, very good. Hearing. And we got the ear cultures. The very last thing I'd like to do is use this tuning fork, and I just want you to let me know when you can hear the sound. So I'm going to strike it on my palm. I'll bring it in. You tell me when you can hear the sound, okay? Very good. All right. Okay, great job. All right. So hearing seems good based on our short tests. I would recommend a longer hearing test if you do find that you're having issues with your hearing. Everything else visually looked very good. However, it will take about a week for me to get those culture results from the lab, okay? So that's the full test. Everything looks good from what I can see, but I'll be in touch in a week. Do you have any questions? Okay, so I do recommend that you come back in about 6 months. When we go out to the desk, I can have the ladies out there schedule you for another appointment if that works for you. Okay, awesome. So 6 months. And other than that, you'll be hearing from me in about a week at the most. Okay? All right, we'll go out then.